welcome back to a Phoenix Concussion Recovery Podcast and Concussion Talk Podcast. Today we have Meaghan, who's a researcher at York University, Toronto Rehab, and Katie, who I got the pleasure of doing a podcast with recently. She's a PhD researcher at Wilfrid Laurier, and I believe as an American I said that correctly. And I work at a major healthcare network in Utah, and I work with Phoenix Concussion Recovery. My name's Lauren Ziaks, and we are so grateful to Nick to bring us all together today to talk about women in concussions. We want to also thank the sponsor of the podcast, so HeadCheck Health. HeadCheck Health bridges the gaps in concussion care through simple, powerful technology. Join organizations like the Canadian Football League, Trek Factory Racing, the Canadian Junior Hockey League, Eastern Washington University, and Volleyball Canada, who rely on HeadCheck to improve communication and optimize care. Visit headcheckhealth.com for more. All right, so we got all that out of the way, and now we're going to talk about girls in concussion, women in concussion, and what that actually means. So would one of you guys like to get started? Meaghan, let's have you talk about. So you're the specialist of women in concussion on the call. So let's have you get started on giving us. Why don't you tell us some of just the overview? What's the difference we think occurs between boys and girls when it comes to sports-related concussion?
Okay. Well, thank you first of all for the lovely introduction. In a word, we don't really know what the difference is between males and females, boys and girls. There are a few hypotheses, and I think the most compelling one has to do, well, I shouldn't say, I'm slightly biased toward one over the others, but I think it's probably a combination of all of them. I think that the fact that women and men, boys and girls have different hormone profiles has a lot to do with brain health and brain function, and then consequently recovery after injury. So that's one of the hypotheses. The other consideration is that biomechanically men and women are different. And when we're talking about an impact injury, biomechanics and body size and muscle mass may make a difference in how people are injured and then possibly down the line how they recover. And then the other probably part of the other piece of this puzzle likely is that boys and girls are socialized differently from a very early age in our culture. And when we look at how concussion is assessed right now, we focus a lot on symptoms. So, concussions are diagnosed in large part, not entirely, but the symptoms that you report play a big part in that. And then the symptoms that you report help determine recovery. And when you look at the research, women are reporting more symptoms and more severe symptoms than men. And there is some thought in the research that may partly be due to how we socialize little girls and little boys to talk about how they're feeling. So it's probably a combination of all three things. I'm biased toward the hormonal hypothesis because that's something that I'm looking at in my own research. But I think it's probably a one piece of a larger puzzle.
So I think that's actually a great way we should just break this thing down. Why don't we talk about those three hypotheses and kind of talk about what we're seeing. So what I think is the most interesting, so as a context, I primarily work with patients who are more than 3 weeks out. And so I think I'm a little bit skewed in how I feel about some of these numbers because I don't really see those spontaneous recovery patients as much. And so for me, what's been fascinating as we've been doing more and more research is that I'm at almost 50-50 for male-female patients in my population. I think our latest study that we're trying to publish was 42% male. And so it's kind of weird. It feels almost foreign to me when I hear these facts and figures that women do so much, so they get better so much more slowly and they struggle more because that's not what I see. But then you go and you do baseline testing at a high school, and it's immediately apparent to me that it has to be some sort of social issue as well, because you'll go to do a VOMS, which is that eye screen. So for the listeners, you're looking at their eye tracking and the way their head is moving, and you're asking about symptoms, and we're looking for changes after a possible concussion. And the boys are always no headache, no dizzy, nope. And then you get the girls team comes in, and the girls are like, oh, well, I'm a little dehydrated today. Maybe I'll put a 2 out of 10 for the headache. And they're immediately so much more forthcoming, and they're not injured. And so it's like a reality check for me, the difference between the two genders when I'm dealing with the healthy people versus the protracted recovery people. So I didn't know if you guys had any opinions about that at all.
On my end of things, like I would say I definitely see more women with persistent symptoms in clinic. I'm not really in clinic with primarily just concussion right now, so I probably don't have the best population to pull from, but even just like my area of focus is more on like the vestibular sensory integration and balance control. And typically it's funny because you say like how the girls are reporting, more symptoms in high school and tend to be socialized that way. However, like they, in that kind of development, there's actually a more ahead of boys in that sense of like in most studies, girls perform better on balance testing, and they're performing the same on like the VOMs when really like those normative values come out. And so like boys tend to get, they kind of mature and become more coordinated a little bit later in their adolescence. So their balance improves a little bit later and they sort of level out into like collegiate age. But then you see like bigger discrepancies post-concussion in some senses of like those symptoms of vestibular headaches, poor balance control are sort of more evident in females. And it's shown that way in a lot of the more recent research, like the dual task gait recovery, even like in the VOMs and different things that have been associated with those balance measures. And you wonder if it is relating, like I kind of, again, with Meaghan, I'm kind of like biased to the hormonal aspect, because even for me, like on a normal cycle, like I'll get migraine associated vertigo, and that's again more like common in females. And like it's just those kinds of things that are related to hormonal functioning that I think maybe exacerbate some of these symptoms in females that we see more oftenly reported. So that's my end of it.
So what's interesting is, so the research is showing that the girls perform better on the test, they have better balance. So then could you argue that maybe the biomechanical piece isn't really as much of a factor, because in reality, the girls should be less likely to have an injury if their reaction time is better and their balance is better? Or do you think because girls develop faster and they have these higher level skill sets, when there is a deficit, they notice the deficit more than maybe a boy who's not as neurologically developed, balance isn't as good, maturity isn't as strong, and so they don't see that discrepancy after a concussion that a higher functioning person might notice that big drop in their level of function? Do you think one of those two is more at play, or do you think that's just coincidental?
I think it's probably more coincidental. Like I don't like, it's usually younger adolescents, like between the ages of kind of like 12 to 14, like beyond that. And that's probably, again, before they really get into contact sports. So it's less commonly reported, I guess, or more likely to be injured in like when you get into those advanced ages where they're playing, contact football, contact hockey in high school. So it's more like the kind of like that pubescent age, early pubescence, like when their balance is different. I would say like beyond that, like the measures that we're using, like it's not necessarily like a conscious thing that they can be aware of that they know it's different. It's coming down to those objective measures where we're, using like center pressure data and stuff, that they're not going to notice the difference of when someone's balance is better than the other. But I think it's balance is more affected by like their somatic symptoms rather than like just the balance control itself. Like it's more related to whether they're experiencing migraines, experiencing dizziness, light sensitivity, all those things that other sensory integration issues, and especially like a lot of Meaghan's work looks at busy environments and lots of different stimuli. And I think it's just the higher incidence of, like I said, like more of the actual experienced symptoms rather than like knowing that maybe they're more coordinated. Like I don't think they would necessarily be aware of that.
Yeah, that's interesting. I mean, so if you look at it from, if you were to go to neuropsych testing, I think what I was trying to get at was, So people who are baseline more intelligent or baseline able to multitask, and they feel like they have all these deficits after their head injury, right? So I could share my own experience, for instance. So I felt like I was having I was having speech deficits and organizational deficits and things of that nature. And when I went to my neuropsych testing and I did my couple hours of testing, what they sat me down and said was, you feel like you're performing different, whether or not I didn't really associate myself as a highly intelligent person at the time. It became more apparent to me after I lost it, what I had before. But it was interesting to me because that ceiling effect of the test. So I guess what I was trying to say was, like, if you, not necessarily that you're more coordinated than somebody else, but do you feel like, or do you think maybe the girls notice some of these deficits more because just like in neuropsych testing, there's that ceiling effect, or they didn't know what they were before, and we don't have anything that can really grasp that missing aspect for them to sort of validate how they're feeling. I mean, they're obviously feeling like they're not performing at the same level. They're feeling like their balance is impacted or they're dizzy. And so could it be that we're not capturing and reflecting properly how they feel compared to how they felt before?
Yeah, I get where you're coming from on that. That's something I think, like, you kind of, it can be kind of suggestive too. Like, if you test balance and, like, they're being watched, it's almost like there's a bit of a white coat thing too, when they're like, I'm being tested, and I tell people to stand still all the time on a force plate, and they end up swaying a lot more probably than if I just was like, don't, like, just stand on this force plate. And so it's when, you're being observed and stuff too. And then, when you're being asked questions, you start to think, okay, like, sometimes I think it gets into the patient's head a little bit when we get really focused in on symptoms and, constantly ask them to monitor it, because then they're, like, so aware of it that they start to almost think about it more than they probably did before. And they may have had some symptoms like that daily, kind of on a regular, but they weren't as conscious of it because they weren't asked all the time about it.
Yeah.
Like, and even things like anxiety and stuff, like, kids experience that. But then when you start asking them about it, they're going to start reporting it more. And then it's like, well, maybe they had something like that before, but, like, really it wasn't, they just never really understood what it was, and really what that is. So then all of a sudden now they're aware of it and they're maybe reporting more, or maybe they just experience it more, and it could almost be a psychological component as well in there.
And then the anxiety piece is a great piece. So Meaghan, as far as the hormone portion of this, are they finding any connection? Is what makes women a little more prone to anxiety or more prone to talking about their anxiety at all becoming correlated to what we're seeing in the after effects of concussion? Are they looking at that at all?
There's not a ton of research out there on the like correlating the socialization to each symptom report. In terms of hormones, this is all like very early stage research, because for a long time we either weren't studying women or we weren't studying them separately from men. Like, so much of the early concussion research was male football players. So, women just weren't included. And it took a longer time to first start including women and then recognize that things are different between the sexes. And one of the studies that is out there looked at where women are in their menstrual cycle at the time that they sustain their concussion. And there is a significant difference in recovery time and symptom reports for women in one phase versus the other. And I can't remember off the top of my head, but the luteal phase of the cycle versus the proliferative phase, there's a significant difference. And then that traces back to there's a number of different things that could be happening, but one of them is there's pretty significant hormone differences between those two times. And right now, that's kind of as far as it has gotten. We have nobody's resolved, whether it's high levels of progesterone. Are high levels of progesterone protective, or do they leave you at a higher risk of prolonged symptoms? Like, that's the level of we don't know. So it's pretty. There's a lot more questions than clear answers right now.
Yeah, that makes sense. I got to tell you, I was very judgmental. I didn't finish reading that study because as a feminist, I was like, oh, here they go again. They want to link everything to our menstrual cycles, just lock us up in a cage for, 4 to 10 days a month kind of thing. And, so I didn't finish. I was like, they didn't find enough for me to read that one. That's a bunch of garbage. No offense to the researchers. I'm sure they worked really hard on that.
I think I pulled that study up actually, and I was looking at it, and you're right, it was the luteal phase.
Was it the luteal phase? Yeah.
Yeah, where like the estrogen and progesterone actually are reduced. And so they say that's the lack of neuroprotective mechanism there, but that is mediated by those hormones. So there's like antioxidant effects and levels of excitotoxicity, and those things are all kind of affected when the hormones levels are lower. And then it's kind of a double-edged sword, because then they say like beyond the concussion, now like you sort of have to track menstrual cycles after the injury to actually look at how if they're one of those people falling into that persistent prolonged symptoms, then you might actually start having to look at their cycle and when their symptoms are recurring. And I had a conversation actually with a patient this morning she's a higher, I'd say like concussion plus, like she's got other things going on too that were from a trauma. But we had this great discussion about, maybe like these kind of waves of symptom recurrence. Maybe we should start looking at when they occur and the timing of them. And perhaps it is linked to your like hormonal regulation in your cycle. And it's kind of tough because it's a couple of years out, so we can't really pin back to her mechanism of injury. But now it's like, these kind of like, it could drive all this autonomic kind of manifestation that we're seeing, because if you think about how it manifests even just with PMS and, that kind of way we normally are, that you think of if you're already having symptoms day to day, and then it comes around to that time and it just gets a bit amplified, and perhaps the migraine, the little bit of vertigo, dizziness, and the autonomic stuff with like stress, cortisol levels maybe just are just a little more responsive at that time. And it kind of was interesting to me. I thought if something really hasn't been tapped into, like you said, that's as far as this research goes. And I think it would be really, really interesting. Like I'm really interested to see what Meaghan's new stuff comes out with. But I think it's a start. And like you said, it's kind of like, oh man, again, like looking at this, but it is what makes us unique. And I think it is something to look into. It's worth investigating further.
I had a patient who was concussed when she was pregnant. She was like 4 or 6 weeks pregnant when she sustained her concussion. And I treated her through the pregnancy, and symptoms were, she had a really hard time, and she was getting back to work, and her symptoms were really like problematic on a day-to-day basis. And then she had the baby and started breastfeeding, and felt like far and away a whole lot better than she had before. And we had this conversation, and I said, probably like there's a whole lot of hormone change that happens there. That probably has something to do with it, but there is no research. Like nobody wants to touch pregnant women with concussion and if you could find enough to make a study.
And then good luck getting an FDA approval or an IRB approval.
Ethics, like nobody wants to touch that.
Chance.
No.
Nick had a good question. So Nick just posted up, and I think you guys might have seen it, or I don't know how Skype works, but so how does the birth control pill affect things? And I would have to assume that maybe it stabilizes the hormones a little bit, but if we don't know how the system works in general, we probably have no idea. And then, of course, that's a man asking that question, right? So there's a difference between an estrogen heavy and a progesterone heavy, and there's non-chemical inducing copper types of birth control. And
so there was a study done a few years ago, and they looked at women. I think I don't remember the details. But they looked at women with concussion. I can't remember if it was persistent symptoms and how long the symptoms have been present for. But they prescribed them an oral contraceptive after the concussion. And the effect was not significant, but they didn't look at baseline hormone levels or, when during the cycle the injury occurred. And so maybe it's helpful, but I think we don't know enough about all these different pieces to answer that question even yet.
Well, and let's be real. There's symptoms associated with PMS, like Katie said, and then there's even more symptoms associated with birth control.
Yep.
In the U.S., they found a male birth control pill, and it didn't make it past the first or second stage of FDA approval because the men had like 3 side effects, and like, God forbid the dudes had a headache or something like that, right? So it didn't make it into the next round. And so I feel like that would be so convoluted. I mean, how would you even begin to study something like that? Like, how would you even begin to isolate variables?
The other interesting piece is too, if women are using an IUD, that is something like you can't always track the cycle the same way. And so that's where it's like literally just start journaling it and see when things occur. And if it's on a certain, space of days, and maybe we can track that. I was looking at a study. I don't know if it's the same one, Meaghan, but it's the Gallagher study from 2018. I don't know if it's the same one, but they did see that there was the difference in symptom severity between women who were taking an oral contraceptive versus not. The women who were taking it had a lower symptom severity than the not using birth control. So there maybe is like I said, a stabilizing or maybe like just a regulatory effect of that, where it maybe doesn't quite reduce as low potentially. And that's maybe that. But then again, we're just kind of pulling, like there's just so little research on this that I think we're just kind of cracking the egg a little bit, like barely getting into it. So I even know there's studies that are looking at just strength training and hormonal cycles, and that's just starting. So this is like completely new on a lot of fronts.
Does it say what the age range was of the people in that study?
It's collegiate. It's collegiate ages, so I'm assuming kind of like 18 to 24-ish. It doesn't give me it was like 40 males, 50 females, so larger study. But be
really interesting too, because young girls who are taking birth control are usually doing so because they're trying to stabilize their menstrual cycle in general. And so it'd be really interesting to see that population versus other populations, because they're already having hormonal, a 14-year-old girl, we could say generally, maybe not always, but a 14-year-old girl on birth control probably is taking it for medical reasons as opposed to contraceptive reasons. And so it would be really interesting to see what their hormonal state is like versus a kid who doesn't need the medication to regulate them properly.
Yeah.
And then if we were to talk about biomechanics, because I know that there was a study, and I'm the worst at remembering details. So there was a study talking about neck strength, and I believe it was for every 1 pound of force, it was a 6% reduction in concussion risk. And then the biomechanics of women typically having longer, leaner necks. So is there any information that you guys would like to talk about as related to our necks? Maybe there's a benefit to women strengthening their necks. Maybe they've now proven that there's no correlation, but I feel like that falls under that biomechanics aspect of things.
Yeah, it definitely does. I think for a while the research was pretty mixed, but from what I've seen, it's starting to tip a little bit toward maybe it might matter. Have you seen anything, Katie?
I haven't looked particularly into neck strength stuff related to, because I've been so focused on like vestibulocular and everything right now. But it makes sense to me just from like a clinician perspective, because you start to think of when younger girls in competitive sport like start really training and thinking about particularly that kind of strengthening. It seems to be like I always think like again, it's maybe a social cultural kind of thing, but girls seem to start training a little bit later and really getting to heavier weights and like really pushing resistance training. And so I wonder if that's maybe a factor, is like if there's a preventative sort of method in there for like that could support the idea that we should be working on strengthening and like heavier weight and putting more load and not being worried about it doing it at a younger age, because more and more is that coming out that it's okay to do that, under sort of following periodization and things. But I feel like the younger girls are not encouraged to lift heavier weights.
Yeah.
This is just a personal subjective thing, but I think
it's fairly accurate.
I think that there's something to be said is that the boys teams tend to push that a little bit more because, there's more overt contact in those sports, and women's sports tend to be non-contact. However, I've been working women's sports for over a decade, and I know for a fact that it's not non-contact. And I think there's something to be said of doing it before they get to their collegiate sports age, because a lot of women, I think, don't start really hitting that kind of weight until then. And then, through high school, like, I don't remember even really lifting weights in high school. Like, and I was playing competitive soccer and, heading a soccer ball from a goalie kick at center field. Like, I didn't know any better then, but you think of how much neck strength that requires. I sort of begin to question those things just subjectively, but that's my 2 cents.
Yeah, I mean, I think that it seems like there's a lot of cultural, social aspects, right? Like, girls are kind of primed to talk more about their symptoms. Boys are told to stuff it down and ignore it. Girls are told to be more careful and, explain yourself more. How often does a girl say sorry when she has nothing to be sorry for? Or they want to answer your questions the way you want to hear them. They're looking to please you almost, versus boys they don't have that as ingrained. I think maybe that might be changing throughout these younger generations, but it seems to still even be, in my mid-30s, like the boys are very different. Their mentality is very different. And a lot of times for girls, they don't want to get bulky. They don't want to, I remember when I was working with professional athletes, some of them would model in the off season. So you're jumping off an 80-foot jump, the same entrance as the boys are, and the boys are training all season, and the girls are worried about, what's it going to do to my muscle mass? And so I think that there would have to be some sort of cultural shift. The more and more aggressive girls sports get, we really want to think about this differently. And I think that we could even just look to ACL prevention. I mean, back in the day, it was almost a discredit to girls that you were more likely to tear your ACL. And now it's just a fact. And you do a pre-training, you keep up your glute med strength, keep up your reaction time, keep up your balance, and then your risk factors get a little bit lower. And so I wonder if that's what will happen in the world of concussion. We isolate some biomechanical factors, we create some preseason training, and then the girls' risks drop a little bit while we wait for society pressures to catch up.
Yeah, I hope so. I think like in ACL incidents of ACL tears, the fact that it's not an indication that women are weaker or they're less adapted to doing any of these things. It's that we as a medical community have not yet acknowledged that women are not just like smaller men. There's a whole bunch of differences that we need to take into account in all kinds of areas. And jumping off what Katie said about, women's sports not being non-contact, it's possible that has something to do with this. Like, do we teach women to hit and take hits the same way as we teach boys, because the sport is supposed to be non-contact? And if contact occurs in women's sport, is it just incidental and therefore less expected, and therefore you're less prepared for it? Like, those are all questions we don't have answers to. But I think we're starting to acknowledge that no, women's sport is not non-contact. It's the contact is different.
And it's often vicious, I got to tell you. If you've ever worked a women's soccer match, at least in the U.S., it's among one of the most vicious things you could ever watch.
I agree.
A lot of hair pulling, a lot of whiplash injuries from ripping someone's ponytail backwards. I also think it's important. I liked what you said. We're not just smaller men, but that doesn't mean that we're weaker. So what I never want to have come out of all this, like women are more prone, women have slower recovery, is that women aren't. It's not that we're weaker. It's not that we're more prone to injury because we are less than. It's not that girls shouldn't play sports because they have a higher risk. And it's not that men who have prolonged symptoms are weak or womanly or there's something wrong with them either, right? And so it's just that we're different creatures, and we serve similar but different purposes on the planet and at some biological level. And so we just have to be treated fairly but differently to keep us all active and healthy and doing all the things that we want to do. But again, and this would be the feminist in me as well, is that men aren't, just because you're a guy who has long-term symptoms doesn't mean there's something wrong with you, because it can be long-term recovery, men or women. And like I said, in my clinic, I'm seeing 42% rate of men. There's not something wrong with all the men that live in this area. And so we want to focus on the girls and why they're different so that the girls get equal attention at the table. But we also don't want to take away from the people who are struggling and make them feel badly about what's going on with them as well.
The analogy that I often use is with like heart disease, because and this is way out of my area of expertise. So I don't know if it's still true, but for a long, long time, women were more likely to die of heart attacks because the way that women report heart attack symptoms is different than the way that men do. And all the research was done in men. So the heart attacks in women were getting missed. And it's not because they were having more or they were more severe, or it was just that the medical model was built around the male experience. And it's true not just in heart disease. So no, it doesn't mean that men are doing anything wrong. It just means that we as healthcare practitioners need to expand how we deal. Like it's more something that the healthcare system needs to deal with. It's not a failing of our patients at all.
Yeah.
No,
and that's a good. Oh, sorry, 1 second. That's a good plug for, they need women's brains for CTE studies. CTE, we don't know anything about it. So for right now, don't freak out at home. But we need women's brains for studies like that, because all this research is being done on male high-risk athletes like football, BMX riders, things like that. And they're all highly symptomatic people who, unfortunately, their lives usually end too soon. And it's a very small sample of the actual population. And so you can actually sign up on, I believe it's through Pink Concussions, or you can just go straight to the BUVA Brain Bank website, and you can actually sign a form. So whether or not you've had a lot of concussions, whether or not you're still symptomatic from an old concussion, you can actually pledge your brain to science after you die, and there's a whole protocol for how you would give your brain. So the best thing that we can do, hopefully none of us are giving our brains anytime soon, but the best thing that we can do is pledge and encourage maybe our older relatives to participate in studies like this, so that women can be accurately reflected in a lot of that research too, because that's where a lot of the money is going, is to that type of research. And so we want women reflected in that as they start to make standards and understand it better. And then, sorry, Katie, what were you going to say?
I wanted to kind of expand upon the points of talking about just biological differences and not necessarily individual differences, and being like more subjective to the patient, and being like, well, why did this happen to me? Even within different levels of hormones between people versus, and a lot of the research so far, I think that comes back to your heart disease example, is it was done with testosterone first. And so they looked at males, and males have been treated for this, and some males have different levels of testosterone than others, and etc. So that the variability even amongst a biological sex themselves, not to mention between, is I think really important to consider. And that's maybe why if men are well, my testosterone levels were off, and maybe if that's me, it's not them, it's just their genetics. It's nothing really to do, it's how their biology just operates. It's nothing that they could really change per se, they'd be aware of. And I think that's something to make clear too, is with women, it's with based on our hormone levels, whether, Meaghan mentioned pregnancy, different phases of our evolution through an age, becoming pre-menopausal, those types of things may change all of those risk factors again. So not just looking at where the cycle is, but where is that individual, and maybe there is some other things that come to play. If they've got mental health concerns that exist prior, we've identified all those modifiers before. But no one actually looked at biological, down to the actual genetics of this. And that I think is worth exploring, but it's going to take obviously a very large study to be able to break down those different kind of what am I trying to say here? Age groups and different progressions through, because even different women can experience those phases at different times, like be earlier, later. You look at adolescent girls, some of them get their periods like 3 years before another girl will. So there's everybody's different even within the biological sex. And I think that's maybe where you see those differences between one female and another female and another male and another male. And I think that's kind of what we're starting, like even in this conversation, it's just kind of starting these ideas in my own head of how this should really be looked at. So, yeah.
Well, even so if we look at something that's been researched a lot more, migraines, for instance, migraines hate change. So maybe you were a prepubescent migrainer, you start your cycle, you're no longer a migrainer, you get pregnant, you become a migrainer again. And so I would think that it would have to be somewhat similar, given that they're both to do with our brain. And we know that there's some sort of hormonal biological factor, but I mean, that's an easy one because there's been so much research. So migraines change when you change, when you go through the different levels of your life. And then what also is fascinating, so we know with the dysautonomia that there's these neuroendocrine changes that occur as well. And so then we get into this whole chicken or the egg. I mean, you've got patients who weren't premenopausal, or at least not symptomatically, and then they have a head injury and all of a sudden it kicks them into early menopause. And why does that happen? And how is that happening? And then is it that the hormones are driving the dysautonomia and the neuroendocrine changes, or are the neuroendocrine changes driving these hormonal changes? And so it becomes so complicated.
Yeah, are you referring to like the hypopituitary function?
Yeah.
Like, is that more so like you're referring to that? Because it does show that there's like secondary changes to the pituitary gland, which you think of where it is located in the brain. It's kind of at the root of the tree, right? So like it's one of, I always think of it as like a tree trunk, and then everything kind of peripheral moving around it. Like the brain stem is the kind of the trunk, and then that's kind of where all our functions sort of converge. And I think that's such a deep structure, though. It's like, how do we really isolate that?
Right. But it's so interesting, when a doctor pulls a blood panel and there's changes in testosterone levels after a head injury, or there's changes in some of the female hormones after a head injury. And so it's really interesting. Is it kicking off a cycle that was going to happen already, or is the system just really not working as efficiently as it was before? And why is that happening?
That's very true. We're all just sitting here like,
come on,
really good question.
I'm supposed to pose the questions and you're supposed to answer them. And the listeners get to learn something. Like, oh, that's how it works.
No, that's a really good question. We can do a study and get back to you in 2 to 4 years.
Yes. You guys go and do your very detailed studies with your blood draws, and I'll just keep doing functional studies of what I observe in the clinic, and we'll all be happy. Well, does anyone have any like burning things that they really want to talk about as far as girls and head injuries go? Does anyone have any like final pieces that we didn't cover that they want to talk about?
I can't think of anything. I think we've kind of blown the hormone thing wide open, but
did it all. The most important thing you can do is stay nice and strong. Remember that it's okay for girls to lift weights. For you can't change your hormones, you can't change your gender, you can't change any of those extraneous factors. And so the things that you can do is you can treat your mental health if that's a problem for you. You can seek help when it's needed. You can stay strong and active and fit, not just playing your sport 2 months out of the year and then doing nothing else and hanging out with your pals, but making sure you stay strong and fit, or play a different sport, which seems to be a unique concept nowadays. But it used to be that we played 3 or 4 different sports a year and trained all these different parts of our body throughout the year. And so I think that for girls, just like boys, staying strong, staying fit, staying motivated, not shying away from an opportunity to play something because you're afraid, but really going out there and doing it just the same as you would if you were born a male. So with that being said, I think it's a nice long podcast here for everyone to listen to again, as usual. So would you guys like to talk about your social media? Meaghan, why don't we start with you? How can people access you? Or do you want to stay anonymous like Harry and Meaghan and just hide over there in Canada? Oh.
I am on Twitter as Meaghan Adams PT. I have a website. I teach some courses, and that is onebrainneuroscience.com. And yeah, I think that's where you find me. Twitter. Oh, Instagram at onebrainneuro. That's how you find me.
And Katie, how do we find you?
On Twitter, I'm at KatieMitch_ATPT. And then on Instagram, I can be found at Thrive Neurosport. And I also have a website, thriveneurosport.ca, with some good knowledge translation stuff on there.
Awesome. I was stalking Katie on Instagram earlier today, and she's got some good, I like the little slides with the facts over them. Those are, I don't know how you make those. You're a little magician, but those are
still
cool.
learning.
I went through a deep dive on your Instagram. I didn't like any old posts, so you wouldn't know about it though. And then you can find me at LZ Concussion on Twitter. You can find me on Instagram at Phoenix Concussion Recovery, although primarily I just mooch off of Nick and rely on him to tag me and things. So I wouldn't really go directly to my Instagram handle for anything, but at LZ Concussion. And then of course you can find out more information about concussions on phoenixconcussionrecovery.com. So Phoenix like the bird or the city in Arizona, phoenixconcussionrecovery.com. And we do have our return to sport program on there. So if you're looking for how to get started on some exercises, you can check that out. And obviously, you can always find us on concussiontalk.com, which is where Nick is so wonderful to post everything and shoot out all these podcasts to everybody. So thank you so much, you guys, for letting me participate with you in all of your discussions. And thank you to all the listeners. And we'll be back with something else for you to chew on in the next couple weeks.
Thanks so much.
Thanks, guys. This has been great.
Music at the beginning of this podcast is by Ben Sound, www.bensound.com.